Thank you so very much for joining us for the State of Spartan Health 2021 Pandemic Influences on Academic Success. I'm Erica Filipich. I'm the Associate Director for the Health Promotion Department, and I serve as the Director for Organization and Development for the National Social Norm Center at MSU. We really sincerely appreciate your time today. Just a few housekeeping items, and then we'll get into introductions in the presentation. We have enabled captioning, so there may be some errors in the translation or some delays. So please hang in there with us if things don't translate just so. This session will be recorded, and we will post it when we're able to on our website, and hopefully send an email out to all registrants and attendees as well. We are going to ask if you have questions, you use the Q&A function. That's a little bit easier for us to make sure we're not missing anything instead of the chat. So if you could pop those in the Q&A forum, that would be wonderful. And then we will do our best to answer them as we go, if appropriate. And then if it would make sense to have a conversation at the end, we will save them and make sure that we get to as many as we're able to. So with that, I want to introduce our panel and presenters for today. Dr. Dennis Martell, the Director for Health Promotion, Student Health and Wellness, and the Executive Director of the National Social Norm Center. And we are joined by Jordyn Salerno, our Data Resource Analyst in the Health Promotion Department and also for the National Social Norm Center. We're having two of our consultants join us today who are part of the National Social Norm Center. Karen Clark. Karen is a Senior Project Manager in the Office for Survey Research at MSU. And Dr. Monique Turner, Chair, Department of Communication here on campus. And we have a few extra folks joining us with their expertise and talent. We'll have them helping moderate our Q&A and providing some technical assistance. So it's Andrew Poole, who's an Education Program Coordinator in Health Promotion and the Director of Communication and Design for the Social Norm Center, and Liz Carr, our Marketing and Communications Manager for Student Health and Wellness. So with that, I'm going to pass things over to Dr. Martell and we'll get started. Thanks so much.
Well, thank you, Erica. And I want to thank you all for taking the time to be with us today. Time is of a premium these days. And as we all know, change is happening quickly within society, within the university, and time is very valuable. And I also want to take the time right now to thank you all, wherever you are, whether you're on the front lines, whether you're working virtually. I want to thank you for participating in this last year. A lot of change, a lot of differences, and I know a lot of us are going into the fall with some anxiety, and we hope that we can help you with this presentation today. You know, one of the things I learned in my days here at MSU, and I've been here 35 years, is back in the PhD days when we were studying a concept called confusion induction. And confusion induction was a therapeutic technique we used to try to get people to look at what is stable in the environment. And I would say right now that we have a lot of uncertainty, we have a lot of confusion, we have a lot of things going on that we don't necessarily have answers to. One thing we can do is allow our students to have some stability. If nothing, let them have an anchor, let them have something that they can hang on to that's stable in the environment. That's what they need right now. I don't want us also to make any assumptions about the behavior that students have exhibited in the last year and that they're going to come back with. We have heard all kinds of things with having two classes coming in now that really haven't been on campus of what might and what might not happen. That's why we have done the NCHA, and that's why we're doing this presentation today. We use the results of NCHA survey to get a snapshot of how MSU student population is doing, what the trends in student health are, and what the impact of societal shifts, policy changes, and program efforts have been. In this presentation, we'll be sharing a selection of overall findings that had a significant change in trends from 2020 to 2021. We'll be posing questions as we go along. Understand that this is NCHA that we have been doing since 2020. So please have an open mind. We're doing this presentation because we also need your help. We're not making assumptions that this behavior is one thing or that there's a causality or inferences. We really like to kind of get your input on the presentation that we're doing today. And with that, I'm going to turn it back over to my esteemed colleague, Jordyn Salerno, to talk about NCHA.
Yes, thank you, Dennis. So yeah, I have the opportunity in my role to work very closely with the National College Health Assessment. And so just a little bit about it. It was developed by the American College Health Association and the Core Institute in 2000. And since then, it's been administered quite a bit to about 500 campuses nationwide and 150 annually. And it really ranges a variety of topics. So impediments to academic performance, sexual health, alcohol, tobacco, and other drug use, weight, nutrition, exercise, mental health, and personal safety and violence. So we get a pretty good snapshot in terms of student health and the different health behaviors that they're exhibiting year to year. So then NCHA at MSU was first conducted in 2000. So we've been conducting it every 2 years since then. So we have data about student health on all those range of topics for the past 21 or so years now. And we do random samples of currently enrolled students, which include undergrads and grads and professionals. And the N usually ranges from 773 was our lowest to 1700. So depending on the year, we consistently administer it at the same time each year, though. So between February and March, we're administering it every 2 years. And then it's managed by the Office for Survey Research. So they do an awesome job of helping us out and have since the beginning. So we're really appreciative of that partnership. So then NCHA 2 in 2021. So traditionally, NCHA has been distributed in even years. So in 2020, we collected data in February, and the survey actually closed just days before the pandemic began and the world really shut down in terms of students moving off campus and all of that. So that being said, we soon realized that although the data that we had from 2020 was really important and it helps kind of look at our trends over time, that we needed data to show how the pandemic affected student health and well-being. So in January of 2021, we decided that it'd be beneficial to distribute NCHA again 1 year later in February of 2021, around that same time that we usually do, to get an idea of what student health looked like during 2020, as well as to compare the 2020 health behavior to the 20 years of data we had prior. So to give us that opportunity to see how did the 2020 year really affect student health on all those range of topics. So we could see how some points maybe went out of trend, some stayed in trend. And so that's a big piece of what we want to share with you today is the data that we saw from that. But the sample for the 2021 survey was a stratified sample of 5,000 MSU undergrad and graduate students. And we sent it out on February 15th, students got a pre-notification email that they would be getting the survey. And then on the 16th, they actually got the survey and we sent a couple email reminders. A total of 905 students submitted surveys during the data collection period. So our N is 905 and includes 718 undergrads and then 187 graduate and professional students. So the overall response rate was about an 18%, and sampled respondents were offered a $10 Starbucks gift card to encourage participation. So that's always good. And then the standard of error was 3.258. So after we collect the data, we always weight the data file to match the demographic profile of enrolled students for spring of 2021. So we do that to make sure we can compare it to the full MSU student population, and we weight it based on class, so graduate and undergraduate status or kind of year in school, and then sex and race. So that being said, we're going to jump right into the data. This really is going to be kind of a quick snapshot. We really want to spend only about like a half hour sharing data so that we can spend a good amount of time discussing questions that you have or hearing your thoughts on different pieces. So we do that intentionally. And usually if you've attended a State of Spartan Health in the past, we usually do kind of like an overarching look at like the trends over the past 20 years and what has changed and maybe different policy or program pieces we think are influencing that, but since this is looking at kind of the pandemic influences, we're really going to spend more of the time looking at that 2020 versus 2021, or how 2021 was different or not from years in the past. So just as a heads up there as well. But yeah, I'll pass it on to Dennis to start us off by talking about some general health topics.
Thank you, Jordyn. So we'll jump with results. The first question in the survey asked respondents to rate their overall health. And if you look at the slide, you will see a trend line from 2020 to, from 2000 to 2020 that shows a decline in number of students who rate their health as very good. And we've seen this trend line for some times, and also a trend line going up who rate their health as poor or fair. Now, can we make any inferences about this? And about the whole NCHA 2021 is that we really wanted to take a look at what students were telling us as far as their experience in this last year. We know that it was a virtual learning experience, but we also know there were a lot of students who stayed in East Lansing, some staying in communal living, some staying in fraternity sorority housing, and some staying on campus. We have not broken it down by those who live off campus and who lived on campus or went back home. We just did it as a whole. And you can see that there's an incline in the number of people who decided to say their health improved last year. Now, some of the things that we made assumptions about when we were even doing a survey have proved not to be true. We would assume that students, because of health being in the news for a whole year with the COVID and everything else, that they would rate their health as less. So we want you to take a look at this and tell us what you think when it comes to why students would rate their health as better or better than average, and why the trend line for poor or fair pretty much stayed the same or actually could have been decreasing. So let's go to the next slide. Sure. Next slide, it asks students whether they are diagnosed and treated. Respondents were asked if they had been diagnosed or treated for 25 different physical health challenges in the past 20 months. The charts you see here show the percentage of respondents who said they were diagnosed or treated for each challenge in the past year. The chart shows 4 bars for each illness: a dark green bar for 2021, a red bar for 2020, orange for 2018, and gray for 2016. If the bars are roughly the same length, then there was a little change from one year to the next. At the bottom right of the chart, we show the percentage of students who reported having at least one of the 25 health problems during the year. It indicates that 47% of respondents reported having one or more health problems in 2021. That was a significant decrease from prior years, as about 52.3% of respondents in 2020 reporting having one or more of the health problems. So let's take a closer look at this in the next slide. This is all over the board. Although some trend lines have been consistent for years, often others have bounced all over. The variables health problems listed here have been shifting over the past decades for such things as chlamydia, high blood pressure, high cholesterol, etc. While some have been sharp increases and decreases, it's unclear if there's a connection between the change in percentage and the 2020 pandemic. So let's look at the next slide. The next slide gives us a little bit more information. If we zoom in on the health problems that have shifted the most from 20 to 21, we can see there were declines in the prevalence of back pain, broken bones, fractures, sprains, bronchitis, ear infections, sinus infections, and strep throat. All things that are either connected to physical activity like broken bones and back pain that may come from vigorous exercise, intramural sports, gym workouts, walking to class, etc., or airborne illnesses like breathing that we could assume has decreased due to COVID-19 protocols and universal precautions such as mask wearing and physical distancing. Now, some of this may to you all seem like, well, duh, they weren't on campus and they were wearing masks and they were isolated. But we also want to get your perspective on, you think, what's different about the campus environment that might increase or decrease some of these health situations. On the other hand, allergy problems, irritable bowel syndrome, migraine headaches have increased in prevalence. We could assume that IBS may be due to an increase in stress, migraine headaches because of virtual life through constant screen time. My own dear partner has migraine headaches and she's been teaching from home for the last year, and allergies from outdoor activities during the pandemic due to not doing things inside. So that gives you a little idea of some of the things students told us that have changed in both physical as well as allergy and sinus things. Let's go on to the next slide, Jordyn. So let's look at physical health, and I'm going to turn this back over to Jordyn to talk about some of the things we found in physical health.
Yeah, so it's a good, or starting off with the general health piece and physical health gives us a good sense in terms of, especially when we think about that first slide where we looked at like health, students rating their health excellent or very good, that if they were less likely to have a cold, flu, or break a bone, maybe that informs why they may have rated their health better this past year. So we'll try to pull out some of those pieces as well to highlight as we go, of kind of evidence for maybe that broader point of health being them rating their health overall very good or excellent. But yes, we're going to jump into physical health. So in another section of the questionnaire, respondents were asked to indicate their height, weight, how many days in the past week they exercised, whether that was vigorously for 20 minutes or moderately for 30 minutes, did muscle strengthening exercises, got enough sleep, ate fruits and vegetables, all the physical health things. So we'll go through some of the results for these next. And NCHA does use the body mass index or BMI scores, and they calculate that through the survey itself. So by asking the height and weight of students. So as a heads up with that as well. And then they're coded into those categories. So in this slide, we examine what the trends have been from 2000 to 2021 regarding exercise, restful sleep, weight status, and fruit and vegetable consumption. So the vertical line that you see for 2009 was when the NCHA questionnaire was revised. So the questions about aerobic activity, muscle toning, those were significantly altered. So the big change that happens there is really just because of how the wording changed. But since then, the results have been relatively stable. So just a heads up there. And the revision also enabled a more precise measurement of exercise or aerobic activity that you can see in the orange line, that PAR-Q physical activity guideline that begins in 2010. So just some housekeeping with this slide. But you will notice that from 2020 to 2021, most all items related to exercise have decreased, such as vigorous and moderate exercise 3 days a week, and just the general physical activity guidelines. And the data also indicates that there's been little change in the percentage of students who eat 5 or more servings of fruits and vegetables every day, which is the light green line. And then the BMI for overweight has actually gone up slightly from 2020 to 2021, which could be due to that decrease in exercise. But really, body mass index is really just currently used in NCHA to track weight trends in student population. So it's not supposed to be a predictor or indicator of health status, and was never really intended to be used as a diagnostic tool. So to just put that out there as well. And we really recommend using a weight inclusive, health-centered approach that promotes positive health behaviors and recognizes that students are capable of achieving health and well-being independent of weight status. So although we see that overweight kind of tick up, or that line tick up, that doesn't necessarily mean, or we don't have evidence that that increase is strictly due to the past year or any factors related to that. But one other piece that I want to point out in this slide is that the data indicates the percentage of students who reported getting an adequate number of nights of restful sleep. So 4+ days a week of restful sleep, that dotted green line, has been relatively constant until the past year, 2021, where it's increased substantially and is actually the highest it's been in the past 21 years, which again could be one of those factors that we think about as an indicator of respondents rating their health good or excellent, that if they're getting enough sleep, feeling rested 4 or more times a week, that may be something that makes them feel better about their health. So the questionnaire also asked respondents to indicate whether or not they've been vaccinated against various diseases. So this is pre-COVID vaccine questions, but mostly just general vaccines. And then whether or not they've had preventative health screening exams. So that could be like dental exams, breast exams, blood pressure checks, use sunscreen, things like that. So the chart shows the percentages of respondents who reported having done each of these in the 2021 survey and the previous 7 other surveys. So that top orange bar shows the results for 2021. And the pieces that we really want to touch on in this is that in 2021, the number of respondents who are vaccinated against influenza increased substantially from 52% in 2020 to 65.4% in 2021. So as a lot of us may know ourselves or noticed in the fall of last year, or just in 2020 in general, that there was a strong emphasis on getting the flu vaccine this year, as the medical field was really urging society to do their part to get the flu vaccine to mitigate the surge on hospitals, or kind of have to mitigate maybe a flu, or having a flu pandemic and COVID at the same time. So that could be a factor in it. But also, again, could be a big indicating factor of that rating their health good or excellent, that if they got the flu vaccine, were less likely to get the flu, then they would feel healthier this past year. And then another piece we want to point out in this is the use sunscreen. So respondents seem to use sunscreen more regularly with sun exposure in 2021 than previous years. And we would love your ideas on this too, because we just have assumptions on this, not necessarily exact data, but we're thinking it could be due to the nature of outdoor activities in 2020, where there was really an emphasis on being outdoors due to COVID precautions, or there has been somewhat of an emphasis on skincare through social media influencers and the media generally in the past year or so. But if you have ideas on that, we would love to hear it, because it's something we've been talking about too. So stress, this is a big piece as well. I'm sure a lot of us have felt it in some way in the past year, and in different ways as well than usual. So the questionnaire allows us to explore stress and emotional health of students. So students were asked to rate how much stress they were feeling over the past 12 months, and that stress could be from any source or combination of sources. In this stacked bar chart compares the results of each of the previous 7 surveys, and you can see the blue, so that middle bar is more than average stress, and then the orange portions on the top are tremendous stress, and the bar increases from 2010 to 2021, and really you can see the increase from 2020 to 2021. Which again, probably doesn't come as a huge surprise to a lot of us. But the chart indicates that in the 2021 survey, about 19% of respondents said they experienced tremendous stress over the past year. And then another around 49.8 or 50% said they experienced more than average stress, which means around 69% of respondents reported tremendous or more than average stress in 2021. And that's compared to 55% in 2020. So and then that being said too, only 0.6% reported no stress in 2021. So this will be a little bit easier to see on the next chart. So as this chart shows, there's been a clear gradual increase in stress until 2021, where you see that sharp increase. And we can assume the increase is due to various challenges of the past year and a half, which included a variety of things, both in society and in the personal life of us and students. So although not shocking, this piece is really important to keep in mind as we welcome students back and help them work through stress management in a safe and productive environment, and really hoping to utilize some of the environmental strategies and coping skills that they've utilized in the past to manage their stress. And then how do we kind of help them figure out what those are for them, and that they can utilize when they get to campus with us. And to get at what the various sources of stress may be for students, another section of the questionnaire asked respondents which of the 12 different issues they found very difficult or traumatic over the past year. So the bar chart shows the percentage of respondents who claimed each issue was traumatic or very difficult from 2010 to 2021. So the top brighter green bar is 2021. And the traumatic or very difficult situations respondents dealt with most in 2021 were academics, which was at 56%, sleep difficulties at 35%, career-related issues at 35%, family problems at 31%, and intimate relationships at 31%, and then personal appearance at 31%. But, and that being said too, although those were kind of the top six, it's also important to note that some of these also had substantial increases from 2020 to 2021, which included academics, career-related issues, family problems, health problems of a family member, and then sleep difficulties. So some of these we may be able to assume reasons why, although we don't have direct data on why maybe these things were difficult for them in the past year. And obviously it would range a variety of topics depending on the person, but academics, obviously with everything going virtual, career-related issues, knowing that the pandemic created hiring freezes, that there were changes in industries and cancellations of internships. But the family pieces I think are important to touch on too. That family problems, obviously a lot of students may have moved home and spent time with their family in the past year. And then also the health problems of family members where families may have had COVID or students were more conscious of the health problems that could lead to COVID complications of their family members. So again, just ideas, and please share or we'll have time to share if you have any other ideas or insights on that. And you all are really the ones on the ground working with students that know intimately some of the things that they've dealt with or struggled with. So I'm sure you have plenty of examples yourselves as well, but just important to keep in mind. And I really find these data to be vitally important. And I think this is the slide that I am drawn to the most as we welcome back to students back to campus after this year, because it's really thinking about what are the things that they struggled with the most and how do we welcome students, acknowledging the experiences that they had and really helping them begin to work through or process through the things that they struggled with that may be different from things that we expected them to be working through in the past. So that's a piece to think about too, related to stress. And to explore emotional well-being further, the questionnaire asked respondents how recently they felt 8 different types of emotions. And it also recently asked how recently they considered 3 different types of self-harm actions. So to touch on those quickly as well, the 8 different emotions are on the right side at the top of the list. And then the 3 different self-harm related behaviors are at the bottom. So all across the board, there were no substantial increases that seemed out of trend, although all of the variables have been increasing steadily in the past 20 years. So although that is the case and it has been gradually increasing, it's still important to note that the increases continue to happen from 2020 to 2021. And the sharpest increase were in the felt very lonely variable, and then the seriously considered suicide variable. And again, the loneliness, we may not be necessarily surprised by that due to isolation within the pandemic and social distancing and all of that. But in terms of seriously considering suicide, that's been something we've been kind of talking through in terms of potential reasons why that may be increased versus other variables. So again, if there are thoughts that you all have, we would love to hear from you or people that do our mental health work on the ground. If you have insight into that as well, that's something we've been talking through. So to turn to a very different area of student health, there are questions in the survey on sex. So the survey includes questions on sexual orientation, participation in types of sexual activity, number of sexual partners, use of condoms, contraception, all of that. But today we'll just briefly examine the results for sexual partners. So sexual behavior is one area of health that many people have significant misperceptions on regarding what students typically do. So the questionnaire asked respondents how many sexual partners, whether oral, vaginal, or anal sex, they personally had during that academic year. So this question has been asked every year from 2000 to 2021. And this chart shows the results. So as you can see, most students, if they have a sexual partner, they have only one sexual partner. And in 2021, the number of respondents who had no sexual partners increased from 29.7% to 34.5%, which perhaps may not be shocking again to us, as a lot of students were at home and not in close proximity to each other or to others in their like direct circle of their similar age. So are due to COVID precautions. So another thing to keep in mind, but really just to show this chart to see that, or to dispel some of the myths that come up sometimes in terms of students and sexual behavior and number of sexual partners. And so switching to another topic, the NCHA survey also collects information about victimization, which we'll review in this following slide. So students are asked whether or not they've been involved in or were a victim of a variety of potentially harmful or troubling incidents during the last 12 months. And again, just to note that the question asks about incidents over the past 12 months. So a significant portion, or basically all of the time that they were reflecting on in the survey, were when students were not at the university. So it's unclear whether any of the incidents reported occurred while students were at the university or not. So just as a note on that. But the chart itself shows the percentage of students who reported that they had been involved in these 10 different situations, as well as at least one of the above, which is the dark green line on the top. And as you see here, from 2020 to 2021, victimization decreased broadly from around 28% to 25%, which we could assume may be in part due to, again, the proximity of students to each other, as most students were not on campus or in the surrounding areas. And then all victimization points decreased from 2020 to 2021, except the variable of in an emotionally abusive relationship, which increased very slightly, although not super sharply, or any enough to warrant any significant assumptions. But overall, 25% of students reported being involved in at least one of these, which is the lowest that point has been since the inception of the survey. So again, just things to think about in terms of environment and how the decrease has come over time. So that being said, I am going to pass it back over to Dennis to talk about alcohol and other drug use.
Thank you, Jordyn. Wonderful caption of some of the things that we need folks to look at. You know, as I watched Jordyn present these, I want to say to the group that is listening today that we shouldn't assume that just because the students experience these things in this last year, that they're going to bring these issues to campus. I know there's a lot of assumption out there about what they're going to do when they come back, about alcohol and partying, sexual activity, or even the stress. I think we can't assume that they're going to, that those same behaviors that they talked about during the COVID isolation is going to happen here. So keep an open mind about some of this. And some of this, we really want you to think about the environment. What in the environment allows students to behave or act the way they do, to make the choices they do? And some of you are saying, well, duh, it's freedom, it's time, it's all. Well, we don't know that for sure. So the first, I'm going to run through these alcohol and other drug slides pretty quickly so we have time to talk with you. But I think you can see it from this slide. We have students in the percentage of students who reported using the top 6 substances in the surveys from 2021. What may be shocking to many of you is that all substance use decreased from 2020 to 2021. I was one of those who made an assumption that students may drink more because of the stress and self-medicating and things like that. But no, actually it's gone down significantly, with alcohol being the lowest it's ever been. To give context, the percentage of students who use alcohol in the previous month in 2000 was 78%, and in 2021 it was 61%, a nearly 17% decline in the last 20 years. And although not as drastic, student substance use for other substances such as marijuana or e-cigarettes that were steadily increasing in frequency actually broke the trend and began decreasing this year. Now we've seen a huge increase in e-cigarettes and vaping since 2016, but there has been a decrease in the last year. So keep this in mind. Let's go on to the next slide, Jordyn. So we have an indicator where we ask students, have you drank more than 5 or more drinks in the past 2 weeks? And some people consider this binge drinking. We consider anything high risk drinking if it's not something that you're used to, or one drink could be high risk drinking, but they use the term binge drinking for 5 or more. So you can see we have asked students over the years. Back in 2020, it was 1.5 times. Now in the last, from 2020 to 21, it's dropped significantly. Now, I will say again, the caveat here is that we have not separated those students who went home and those students who lived in East Lansing and those students who live in communal living. I can tell you that alcohol and drug use among some of those demographics, such as if they identified as fraternity, sorority life, didn't change. In some cases, it did go up, and we can sort out those variables for you. But as a student body, you can see that those who say more, 1 or more times of 5 or more in the past 2 weeks has gone down. Let's go to the next slide, Jordyn. Once again, we asked students about the percentage who did not drink, drank 1 to 2 days or 3+ days in the past month. We have a percentage of students who are choosing not to drink. That has been steadily increasing since 2000. And we have steadily decreased the amount of students who have drank more than 3 days per week. You can see the trends here. I'm not going to talk too much about it, but you can see that the trends changed significantly in the last year. Okay, let's go to the next one, Jordyn. Okay,
oh, sorry. I just wanted to make one quick point too, because I think in this slide, the green line, so that middle line of drinking none in the past month, is where like our biggest increase has come. I think that's a really important point to think about, that nearly 39%, so almost 40% of our students haven't drank in the past month. And that is significantly different than it has been in the past. So things to think about again, as we welcome students back to campus, but just wanted to add that in.
No, it's a really important point, Jordyn, because I think what we need to provide as much as possible is as many engagement opportunities as possible for students when they come back. We're going to stay away from the concept of alcohol-free activities, but as many engagement opportunities, because it shows that students didn't choose to drink for one reason or another. And we need to take a look at that. So this one shows average BAC, and once again, you can see the declines in the average BAC, which is kind of a variable that's constructed by the many drinks they had the last time they partied, over how many hours they drank on that occasion, their weight, and their sex. And you can see overall that all students, it was 0.038, which is way under what we would consider intoxication. So you can see how BAC has actually dropped in the last year too. Jordyn, let's go to the next one. Mean number of drinks, once again, I don't really need to talk about this very much, but you can see the significant decrease. It jumped around a little bit there between 2008 and 2016, but then it significantly started to go down again. In the last year, you can see the mean number of drinks now among all students is 2.93, which is significantly lower than what we started in 2000, which was 5.42. Next one, Jordyn. Once again, this slide pretty much shows the trend lines of the people who drank 0 to 4. The people who choose to drink 0 to 4 has been steadily increasing over the years, and those who choose to drink 8 or plus more has been decreasing. And you can see the increases from 2020 to 2021, and you can see the decreases there. So we've seen a steady decrease in those who, what we would say is very harmful drinking, 8 or more, and those who decide to drink 0 to 4. Next. This is one that I've always had a keen interest in, and one I think that both MSUPD, ELPD, and folks in the area have always been very concerned about, is those who choose to drink after driving. And you can see back in 2000, we had 46.3% of students who reported that they drove after drinking, to now in 2021, and a significant drop from 2020, 18.1% to 12.5% who choose not. Now, I can't make any assumptions about this. It's been a steady decline. There was an incline back in 2014, but also there's been a steady decline now to less than, basically about 0.5% who said they reported drinking after driving after drinking 5 or more. So we see a significant decrease from 2020 to 2021 with those who decided to drive after drinking. Next one, Jordyn. This is experienced various trauma of harm from drinking in the past year. The questionnaire asked those who drink whether or not they experienced any of 9 different types of harm as a result of their drinking. This chart plots trend lines for percentage of respondents reported experience each of these 8 different adverse outcomes, including experiencing at least one of these. Across the 12 surveys from 2000 to 2021, so all adverse outcomes from drinking have decreased from 2000 to 2021, where experienced at least one of these decreases from 49% to 41.7% from 2020 to 2021. The variables did something you later regretted and forgot what you were, what you did were the sharpest decreases, and we would think that because usually you find those with students who have drank more than they normally would, or drank to the point of being drunk where they forget what they did or later regretted. The only variable that slightly increased was had unprotected sex, and we've had quite a bit of conversation about what that might be, and we'd like to hear your perception of why that might be. Jordyn, go to the next one. Okay, so we asked 25 different health challenges. We asked students whether those health challenges, the use of alcohol, back pain, or any of these things, whether they affected your academics in one of 4 ways. And what we're going to show you in this next slide is just some of the ones that we chose to highlight, which had the biggest differences between 2018, 2020, and 21 in terms of challenges that affected their academic performance. You can see here that anxiety, depression, sleep difficulties, and stress had a greater effect on students' academic performance than in past years. And as I said before, we don't have to assume this is going to be what's going to happen when they get here. This is what they're telling us that happened last year during the pandemic. On the other hand, we find it important to note that colds, flus, sore throats, sinus infections, ear infections, bronchitis, strep throat effect on academic performance decreased significantly from 2020 to 2021, which really shows where the benefits to COVID precautions such as mask wearing, physical distancing, and other universal precautions just slowly reduce the amount of impact on academic harm that students said. So as we go into the fall, the stressing of the universal precautions, keeping your hands clean, wearing a mask, not only helps slow the spread of COVID, but also seems to decrease the amount of colds, flu, sore throats, strep throats, and those air-generated challenges. So I also want to show this last slide, which is the academic harm experienced by drinking. You can see a significant decrease. The top green line shows alcohol-affected academic performance from 2000 to 2021. In 2000, we had 10% of the students telling us that their drinking-related behaviors has affected their academics. I mean, that's 1/10 of a student body of nearly 50,000. In the last year, that has decreased by almost 50% from 4.3% to 2.1%. As Jordyn said before, we know there's been a decrease in the use of alcohol. Can we point to what the cause is? We don't know. Is it because they were home? Is it because they had less social activities in which to drink alcohol? We know when they come back, there will be some sort of, let's call it a celebration of returning back to normal, a celebration of being in class. As Dr. Turner showed in some of her surveys earlier in the year, most students want to come back to be in class. They want to come back to have that experience of being in a class with other students. They don't necessarily want to come back to drink alcohol, but celebrations and alcohol seem to go hand in hand in this society. So we have to really think about what in the environment that we're doing allows students to celebrate with alcohol. I just want to show you that slide. So we're going to go to the last slide. So what are the takeaways here? And I really would like Ms. Clark and Dr. Turner to join us. What are some of the takeaways from this data? Well, we know there's various challenges that affected academic success. There are various challenges that affected faculty and staff. We've heard all kinds of stories from the loss of people in your life to COVID, to childcare, to being a one-parent family, to trying to work from home with all the different challenges there are. We've had a lot of losses in the last year, and not just losses in the lives of people, but losses of normalcy, losses of experiences. All of these things, students, faculty, staff, and our society tend to want to grieve about. We need to allow them to grieve the loss of experiences, the loss of normalcy, the loss of individual people in their lives. So there's various challenges affected by academic success. Jordyn or Mo, do you want to add anything to that one?
I don't have anything to add, but I just think it's to reiterate your point that we not brush over like, well, we're back now, so let's just get over it. We need to recognize that, they did lose a lot, and to be empathetic with that loss.
The second takeaway is substance use behaviors have changed. Have they changed among the students who stayed in East Lansing? As we know, there's been significant challenges in the city of East Lansing and downtown, and we've seen different types of emotions expressed in conversations over the last couple of weeks. We know that there's a lot of anger out there, anger of loss, anger of politics, anger of all different kinds of things we've experienced. But substance use has changed. So it doesn't have to go back. I mean, I've heard everything from this fall is going to be a big party everywhere. Well, it could be, but let's not assume that. Let's try to look at the environment and see what we can do to change that. The celebrations committee and other groups are meeting now to kind of look at the environment and see what it is that we can promote in the next year that will allow students to find challenges and changes and opportunities that don't necessarily include alcohol. Jordyn or Mo or Karen, do you have anything else to add to that?
I think this piece has been something we've been talking about a lot over the past couple months, just based on dispelling some of the myths that have come in the past year related to everybody's been drinking, and especially with students. And I know a lot of people on this webinar do a lot of kind of forward facing work with students. So as much as information and data that we can give you all as being on the front lines to be able to talk with students and to dispel some of those myths, or to give them some data that we actually, like 39% of students didn't drink at all in the past month, and to be able to help work through some of that, to dispel the myths and to empower them that if that is something that they want to continue when they come to campus, that we can help them connect and help them have an experience here that doesn't include alcohol, if that's something that they want.
Agreed. And I do have a couple of things I would add here. One is that it is a normal human tendency to have something called the accessibility heuristic. And that is when we have news that's filtering around our society, or a specific event that sticks out, like some of the parties that happened in East Lansing, we tend to overestimate the number of other people engaging in those behaviors too. But our survey data would indicate that those were actually rarer cases, that it was fewer students that were engaging in a lot of drinking, whereas most students were at home. They reported physical distancing, they reported mask wearing. I know we didn't report on that today, but overall, the self-report data indicates the preponderance of Spartans were engaging in preventative behavior. I think that it's important, and Jordyn said this, but we tend to underestimate our undergraduates because of the stories we do hear about those who are misbehaving. And I just want to reiterate that the majority of students weren't. Some were, and it caused us quite a bit of issues. But the final thing I would add, and I think probably Dennis and Jordyn are going in this direction, is that we take these normative data that we see from 2020 and 2021 and leverage it. We know that communicating about positive norms affects people's behaviors. And I was looking at the whole 20-year trend, and it's incredible. I mean, I left Michigan State in '99 and came back in 2019. So these data are basically the whole time I was gone, and look at the change in undergraduate behavior particularly. It's stunning how much healthier they are overall.
Thank you, Mo. I really appreciate that. You know, the third takeaway real quickly is that many COVID precautions really benefited students. I mean, we knew in the past in doing surveys that colds and flus were probably the #1 reason why students actually missed class. It wasn't because they didn't like the class or they didn't get up. The colds and flus. The colds and flus will restrict your ability and your capacity to engage. So, and I think it's important that we destigmatize those who want to wear a mask outside or in areas, even if we suspend the mask mandate. There are people who may choose to continue to wear masks, and we need to destigmatize that. It is a precaution. I'm going to move on to the next one real quickly. Stress management is necessary. But let me say this, you know, when we had opportunities, and I think Dr. Petishnak would say the same thing, when we had real opportunities to talk with students one-on-one in orientation sessions, as well as their parents, we'd say, you know, you got to this age of 18, 19, 20, 21 because you had coping mechanisms. We can't stop believing that students don't have coping mechanisms when they get it. We have to stress to them, and I know there's probably academic advisors on the call today on the webinar, as well as faculty. Faculty and academic advisors, keep in mind that when students do get stressed or you see this stress going on, harken them back to the days when they had coping mechanisms that they utilized through high school, grade school, whatever. They may have changed, but then give them other opportunities. So instead of stress management, stress the point that they can manage this with the things that they've done in the past, as well as all the opportunities we have now. Jordyn or Ramo, did you want to say anything else? I don't think so. Okay, let's do, this is more of a question to all of you, is how do we address the unique challenges of 2020 and 2021? And by these unique challenges, as I said in the beginning, I am not downplaying the stress challenges that faculty, staff, and our community have. Everyone's been through a lot in the last year. And I give a lot of thanks to everyone who was on the front line, as well as those who made virtual learning work. We have a lot to be thankful for. I continue to say, instead of counting all the things that are wrong and all the things that we should do, we should count our blessings. I am privileged to work with some amazing people, and some of those are on the call today. And I know you're all working hard out there. So give us feedback. This is just data from one source, NCHA. We try to look at those things that you might take into consideration when you're talking to students, or when you're making policy, or just thinking about how best to help students when they come back. But more than anything, I would say, take care of yourself. We cannot help anyone. if we don't take care of ourselves. And that means taking time. I've heard over and over again over the last 2 weeks, we got so much to do before students get here. Well, things are going to change, and we know they're going to change. So as much as possible, take care of yourself, folks. We need you to do that in order to progress with a semester that's going to be of some kind of normalcy. With that, we have additionally slides that we have health promotion resources that you can take advantage of. We have an AOD program, collegiate recovery. We have one of the best collegiate recovery programs in the state of Michigan, if not nationally. And we have nutrition services, sexual wellness programs, Spartan fit wellness programs, student involvement and support, as well as we have the CAPS resources, CAPS Connect, psychiatry, LGBTQ plus services, ADHD services, intensive clinical services, referral coordination, outreach services, crisis services. This presentation will be available for you to look at if you want to refer back to the data or any of the other resources. And more campus resources here with RCPD, OISS, recreational sports and fitness, gender and sexuality campus center, student affairs, and services. Emergency resources also include Center for Survivors, Safe Place, MSU Police, 24/7 CAPS crisis counseling, 24-hour information nurse, crisis text line, and National Suicide Prevention line. We also have Connect with Us. You can follow Healthy Spartans on Instagram, Twitter, and Facebook to get the latest news, events, health tips, and more from student health and wellness. And I don't know how much time we have. If some of you can stay on, we'd like to know what you think. And I'm going to turn it back over to Erica to either give a concluding statement or we can refer to some of the notes in the chat.
Yeah, so we are almost at time. So there are a few kind of thoughts offered in the chat in the Q&A as we went along in terms of the stress piece, which I thought really might be helpful for the group to hear. So one thought is potentially the increased stress could be from the combination of doing coursework while living at home. So the thought is that this individual has interacted with students while they're living at home and they're getting all those extra tasks put on them that they wouldn't have if they were, quote, away at school. So certainly a consideration. Also a question, and this might be an offline conversation we can follow up on, a question around the international student response and if there was enough of a response to see any statistical differences between domestic and international students on some of these items. And also sharing that there is an interest in this perceived health status. And perhaps it's because they themselves saw the illness around them and personally decided that their health maybe was higher than originally perceived. So I think those are just the last comments. Yes, and sometimes just student behavior we see can be interpreted as the norm when it's the most visible, unfortunately. So I think that is it for the Q&A.
And I think that if you have the question about whether we have enough N for separating out certain populations, I believe in Ms. Clark, who is an expert at this, and I feel very fortunate to have her with part of our team. I believe she would say that we probably have an N that's small, but enough to give you a breakdown, whether it's students who lived on campus, who chose to live on campus or off campus, Greek affiliation, age group, as far as international students. So if you would like any of those breakdowns, we can try to provide those to you before the beginning of the fall, if possible. Anything else?
Yes, there is one last question. So the question is related to what the survey offers. Does the survey offer information about how preventative educational programming may be influencing a decrease in the various segments, or would you attribute it solely to students not being on campus?
That's a really good question. I think the assessment does show us some indicators that some of the things we're doing have impacted, and even some of the things that we have thought about, with the sexual activity and not, having unprotected sex. Some of that conversation was, that the choice to have unprotected sex is because they weren't connected with condom connections on campus, or did they have access to it? We try to provide as much harm reduction as possible in many of these areas, from AOD to sexuality to other issues. So we do have some assessments that are out there now that will show us some of the preventive things we're doing. We didn't have a lot of contact with students when they were virtual learning. So some of our normal tactics and environmental conditions weren't there. So, but good question.
And I would just say, if anybody has further questions or ideas, or wants to dive into certain student populations or see what the differences are, just feel free to reach out to us or me, like whatever comes up. But yeah, and we'd be happy to work with you on that to get you the information that you need. So to put that caveat out as well.
I want to thank you all for being with us today. Like I said, your time is very valuable. I wish you nothing but joy and happiness in the fall. I tell you to breathe as much as possible. Tell the students to breathe. There will be a lot of change, but that's inherent in our environment right now. And we wish you nothing but health and wellness as you go forward. So thank you again. Thank you to the panel members. Thank you to Dr. Turner, Karen Clark, to Erica for putting us together, Jordyn, who is a wonderful addition to the staff here at MSU, and along with Liz Carr and Andrew Poole. So thank you again. And if you have any questions, please address them to us.
Thank you, everyone.